Hello, and welcome to Healthy Aging Blueprint. I'm truly grateful you're here. On this channel, we explore simple, powerful ways to care for your body, nurture your mind, and live with purpose at every stage of life. Wherever you're watching from, I wish you good health, peace, and lasting happiness. If you find value in today's video, don't forget to hit that subscribe button and turn on notifications so you never miss a step on your journey to aging well. Have you ever questioned whether the pills you take every day could be doing more harm than good? What if the medication you trust most is actually putting your heart at serious risk? And could it be that something sitting quietly in your medicine cabinet right now is silently damaging your health? As a heart surgeon with decades of hands-on experience, I've seen far too many seniors come into my office suffering from chest discomfort, shortness of breath, or sudden fatigue. At first glance, it seems like the natural effects of aging, or maybe just stress. But upon closer examination, a troubling pattern emerges. Many of these symptoms can be traced back to common medications they've been taking for years. These are prescriptions meant to help, but instead, they're quietly undermining heart health. In this video, I'll expose 7 of the most dangerous pills routinely taken by millions of people over 60. These drugs often go unquestioned, yet they're slowly eroding heart function, and most people have no idea. You need to stay with me through the end of this video because one of these medications might already be part of your daily routine. And knowing the truth could literally protect your heart and save your life. Before we dive in, if you find value in content like this, please take a moment to like the video. It helps us continue sharing essential health lessons for aging wisely. And if you haven't subscribed yet, I encourage you to do so and turn on notifications so you never miss a new release. If this video speaks to you, comment 1 below. If not, comment 0 so I can continue improving our content for your needs. Now, let's begin with pill number 7, non-steroidal anti-inflammatory drugs, or NSAIDs. These include well-known medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and even aspirin in higher doses. Seniors often rely on these drugs daily to manage chronic conditions like arthritis, joint stiffness, back pain, or muscle aches, issues that understandably become more common with age. But here's where the problem starts. Many older adults take these medications regularly without fully realizing the serious cardiovascular risks involved. NSAIDs function by blocking specific enzymes responsible for inflammation, which reduces pain and swelling. However, this action doesn't come without side effects. These drugs can lead to elevated blood pressure because they promote sodium and water retention in the body. The result? Fluid buildup that puts extra strain on the heart. And for seniors, whose hearts may already be vulnerable due to age-related changes, this added burden can be extremely dangerous. Over time, this increased pressure can contribute to major complications, including congestive heart failure or the worsening of pre-existing heart conditions. It's a hidden danger that deserves far more attention. NSAIDs have also been linked to atrial fibrillation, an irregular heartbeat, as well as other cardiovascular complications. Over time, prolonged use can damage the inner lining of blood vessels and weaken kidney function, both of which are essential for sustaining a healthy heart. The kidneys play a key role in regulating blood pressure and filtering waste from the bloodstream. When their performance declines, it can set off a cascade of issues that directly affect cardiovascular health. For seniors already dealing with elevated blood pressure or relying on heart medications like ACE inhibitors or diuretics, the problem becomes even more complex. NSAIDs can interfere with these medications, reducing their effectiveness and placing the heart under silent, persistent strain. What makes this especially dangerous is that many of these harmful effects occur gradually and without obvious symptoms, giving the false impression that everything is fine while damage quietly builds. It's easy to assume that over-the-counter medications are harmless, especially when they're so readily available. But for older adults, that sense of safety can be misleading. Pain management is important, no doubt. But should it come at the cost of your heart's long-term health? For seniors with heart conditions or high blood pressure, safer options may include acetaminophen, Tylenol, physical therapy, or other non-pharmacological approaches. But the key is this: always talk to a qualified healthcare provider before using NSAIDs for more than a few days, particularly if you have a history of heart disease, kidney concerns, or are taking other cardiovascular medications. That brings us to pill number 6, thiazolidinediones, commonly referred to as TZDs. These include medications like pioglitazone, Actos, and rosiglitazone, Avandia, which are often prescribed to help control blood sugar levels in individuals with type 2 diabetes. While they can be effective at improving insulin sensitivity, there's a hidden price, especially for seniors. These drugs have been associated with significant risks to cardiovascular health. This concern becomes even more serious for individuals over 60, many of whom already live with underlying cardiovascular conditions. Thiazolidinediones, or TZDs, help the body respond better to insulin, which can be beneficial for managing type 2 diabetes. However, they also tend to cause fluid retention, leading to swelling in the legs, ankles, or other areas. This buildup of fluid creates additional strain on the heart, potentially increasing the risk of congestive heart failure. For seniors whose hearts are already working harder due to age-related wear or chronic health issues, this added pressure can be dangerous. Seniors with diabetes are often managing a combination of risks: elevated blood sugar, high cholesterol, and hypertension. Adding a medication that causes the body to retain even more fluid creates a perfect storm that can accelerate heart complications over time. What's particularly concerning is that TZDs can mask the early warning signs of heart failure. Symptoms such as fatigue, swelling, or breathlessness can easily be dismissed as part of getting older or complications of diabetes, delaying timely diagnosis and intervention. For older adults who already have a history of cardiovascular disease, even mild forms of heart failure, or related risk factors like obesity, TZDs can quietly intensify cardiovascular damage. Despite their usefulness in lowering blood sugar levels, the long-term impact on the heart may outweigh the benefits for many seniors. The good news is that there are safer and often more heart-friendly alternatives available. Medications like metformin or newer options such as SGLT2 inhibitors have shown promising cardiovascular advantages and are often better tolerated. If you're currently taking a TZD and have noticed unusual swelling, sudden weight gain, or shortness of breath, it's important to speak with your healthcare provider. There may be safer options better suited to your overall health needs. Remember, managing blood sugar is essential, but it should never come at the expense of your heart. Let's move forward and take a look at another class of medications that could be silently affecting senior heart health: sedative hypnotics, commonly used as sleeping pills. Using sedative hypnotic medications to improve sleep quality, it's crucial to understand that while these drugs may offer temporary relief, their long-term use can carry serious consequences for heart health, especially for individuals over 60. These medications function by depressing the central nervous system, which slows down brain activity, heart rate, and blood pressure in order to induce sleep. At first glance, this calming effect might seem like a benefit, but beneath the surface, it can impair the body's natural ability to regulate vital processes during rest, such as maintaining proper oxygen levels or reacting to stress signals. One of the most concerning outcomes is the increased risk of developing or worsening sleep apnea. This condition causes repeated interruptions in breathing throughout the night, and each of these episodes places a heavy burden on the heart. Over time, this strain can lead to arrhythmias, elevated blood pressure, and in some cases, heart failure. What makes it even more dangerous is that these events often occur silently, without the individual realizing the underlying cause. Moreover, Sedative hypnotics can interfere with the effectiveness of commonly prescribed heart medications, including beta blockers and calcium channel blockers. These interactions can weaken your heart treatment plan without any obvious warning signs, quietly reducing your body's ability to respond to cardiovascular stress. In seniors, the risks escalate even further. Side effects like confusion, dizziness, and impaired coordination are more common in older adults, which increases the chance of falls, injuries, and even hospitalizations. These physical setbacks, in turn, can lead to additional complications with heart health. Over time, prolonged use of these sleep aids may also accelerate cognitive decline, making it harder to stay on top of essential daily habits like medication routines, heart-healthy nutrition, and physical activity. Instead of depending on these medications, consider safer, more sustainable approaches to improving sleep. Cognitive behavioral therapy for insomnia, CBTI, mindfulness-based relaxation techniques, or addressing root causes such as chronic pain or anxiety may offer relief without endangering your heart. If you're currently taking a sleeping pill on a regular basis, it's crucial to have an open discussion with your healthcare provider. Together, you can evaluate the potential risks and explore non-pharmacological strategies that may better support both your heart and brain health without the unintended side effects. Pill number 4, tricyclic antidepressants. These medications, often abbreviated as TCAs, include drugs like amitriptyline, nortriptyline, and imipramine. Historically, they've been prescribed to manage depression, anxiety, and even chronic conditions such as nerve pain or migraines. While they've helped many people in the past, TCAs come with a heavy cost, especially for adults over 60. Their use today has largely been phased out in favor of safer, more targeted antidepressants. But some seniors are still prescribed them without realizing the full extent of the cardiovascular risks. TCAs can interfere with the heart's electrical conduction system, which controls your heartbeat. This interference can lead to arrhythmias, heart blockages, or sudden fluctuations in blood pressure. For seniors with underlying conditions like atrial fibrillation or bradycardia, even low doses of these drugs can significantly raise the risk of dangerous complications. What may seem like a small prescription for mood or pain relief could quietly be setting the stage for a serious heart event, and the dangers don't stop at the heart. These medications can cause dizziness, sedation, and a condition called orthostatic hypotension, where blood pressure drops suddenly when standing up. These side effects are especially problematic for seniors, increasing the likelihood of falls, fractures, and hospitalizations. Each incident further taxes the heart and weakens overall resilience, creating a dangerous cycle that becomes harder to break. Despite these well-documented risks, some healthcare providers continue to prescribe TCAs out of habit, cost considerations, or because they've worked in the past. However, with the advancement of medicine, safer and more effective alternatives are now available. Selective serotonin reuptake inhibitors, SSRIs, for example, offer similar benefits with significantly lower cardiovascular risks, making them a much better option for many older adults. Serotonin norepinephrine reuptake inhibitors, or SNRIs, have emerged as a safer alternative with a more favorable cardiovascular profile. If you're currently taking a TCA and begin noticing symptoms like irregular heartbeats, persistent dizziness, or unusual fatigue, don't ignore them. These may be warning signs that your heart is under more strain than it should be. Reach out to your doctor right away. Regular monitoring and honest communication about switching to a more heart-friendly medication can make all the difference, protecting your cardiovascular system while still managing your emotional well-being or chronic pain. Pill number 3, decongestants, specifically pseudoephedrine and phenylephrine. Found in many common over-the-counter medications like Sudafed and various cold, flu, or allergy relief formulas, these drugs are often seen as harmless. Many seniors use them routinely to ease nasal congestion, sinus headaches, or seasonal allergies. But despite their convenience, these medications can quietly put your heart at risk, especially if you're over 60. Decongestants work by narrowing blood vessels in the nasal passages, which helps reduce swelling and makes breathing easier. But here's the catch. This vasoconstrictive effect doesn't stay confined to the nose. It impacts blood vessels throughout the entire body, including those feeding the heart. This systemic tightening can result in increased blood pressure, a racing heart rate, and additional workload on an already aging heart. For seniors already managing hypertension, arrhythmias, or any form of cardiovascular disease, this added stress is not just uncomfortable, it can be dangerous.
Even something as seemingly minor as a cold pill can set off heart palpitations, rhythm disturbances, or in some cases, a full-blown cardiac event. In more serious cases, the side effects of decongestants, such as nervousness, anxiety, or lightheadedness, aren't just minor annoyances. They can be early warning signs that your heart is under more pressure than it can safely handle. Seniors are especially vulnerable to these effects because the natural aging process brings changes like reduced kidney function and less flexible blood vessels, making the cardiovascular system more sensitive to these drugs. Many people assume that over-the-counter medications are completely safe, simply because they don't require a prescription. But for older adults, even brief use of decongestants can be dangerous. To reduce these risks, seniors should pay close attention to medication labels and avoid any products containing pseudoephedrine or phenylephrine, especially if they're dealing with high blood pressure or a heart condition. Fortunately, safer and gentler alternatives exist. Saline nasal sprays, steam inhalation, or non-stimulant antihistamines can often offer effective relief without placing your heart at risk. If you're unsure, speak with your healthcare provider before using any decongestants, particularly if you're already on other medications or managing cardiovascular issues. Pill number 2, proton pump inhibitors, or PPIs, an often overlooked threat to long-term heart health. Drugs like omeprazole, pantoprazole, and esomeprazole are commonly prescribed to treat acid reflux, GERD, and heartburn. These digestive issues are widespread among seniors, and millions depend on PPIs daily, trusting that they're a safe and reliable long-term solution. But recent studies are raising serious concerns. Over time, regular use of PPIs may actually increase the risk of cardiovascular problems, especially in adults over 60. These medications work by drastically lowering stomach acid levels, which provides quick relief from discomfort. However, could this acid suppression be doing more harm than good in the long run? The burning sensation of acid reflux can be relentless, and PPIs offer fast, effective relief by reducing stomach acid and protecting the esophagus from damage. But while they work well in the short term, long-term suppression of stomach acid can interfere with your body's ability to absorb key nutrients, especially magnesium. And here's where things become risky for the heart. Magnesium plays a crucial role in maintaining normal heart rhythm, supporting muscle function, and sustaining energy levels. When levels drop too low, a condition known as hypomagnesemia, serious problems can follow. Irregular heartbeats, fatigue, muscle cramps, and even seizures can emerge, sometimes without much warning. Seniors, in particular, may not immediately recognize the signs, mistaking them for normal aging or unrelated health issues. Beyond nutrient absorption, there's another layer of concern. Long-term use of PPIs can disrupt the gut microbiome, the community of beneficial bacteria that supports digestion and immune balance. When this balance is thrown off, it can trigger chronic low-grade inflammation throughout the body. And systemic inflammation is no small matter. It's been directly linked to conditions like atherosclerosis, where arteries harden and narrow, setting the stage for heart attacks and strokes. Several studies have drawn a connection between extended PPI use and a higher risk of cardiovascular events, especially among seniors already managing health challenges such as high blood pressure or type 2 diabetes. These hidden risks can quietly build up over time, often going unnoticed until they reach a critical point. If you're a senior who has been taking PPIs for several weeks or longer, it's important to reevaluate whether they're truly necessary.
Many of these prescriptions are handed out indefinitely, without addressing root causes like poor diet, excess weight, or a hiatal hernia. Often, making simple lifestyle changes, like steering clear of acidic foods, eating smaller meals, or shedding a few pounds, can reduce or even eliminate the need for acid blockers altogether. However, if long-term PPI use is unavoidable, it's essential to work closely with your healthcare provider. Regular monitoring of your magnesium levels and cardiovascular health can help you catch potential issues early and take action before they escalate. After all, managing heartburn shouldn't come at the cost of your heart. Talk with your healthcare provider to explore safer alternatives, such as H2 blockers like ranitidine or mild antacids for less severe cases. The key is to use proton pump inhibitors at the lowest effective dose and for the shortest time necessary. Prioritizing your heart health means digging deeper to identify and treat the root cause of symptoms, rather than relying endlessly on medications that may quietly harm your cardiovascular system over time. Pill number 1: calcium channel blockers and their risks for seniors. Calcium channel blockers, often referred to as CCBs, are a commonly prescribed class of medication for older adults. They're frequently used to treat a range of cardiovascular conditions, including high blood pressure, chest pain from angina, and irregular heart rhythms. Names like verapamil, diltiazem, nifedipine, and amlodipine often appear on seniors' prescription lists. For many, these medications are essential. They help by easing the heart's workload, lowering blood pressure, improving circulation, and stabilizing heart rhythms. But here's where caution is crucial. Certain types of calcium channel blockers, especially older ones like verapamil and diltiazem, can carry notable risks when used long-term, particularly for seniors. How do calcium channel blockers work? They reduce the influx of calcium into the muscle cells of the heart and blood vessels. This results in relaxed, widened arteries and smoother blood flow. For someone battling high blood pressure or angina, this can bring relief and stability. And for those with arrhythmias, these drugs can help maintain a steady heartbeat. However, the same mechanism that makes them effective can also cause unintended consequences, especially in older adults. As we age, the heart's pumping efficiency naturally declines, and kidney function may become less robust. When these medications are used without careful monitoring or combined with other drugs, problems can arise more easily. That's where the danger begins. Seniors are particularly susceptible to the side effects of calcium channel blockers, not only because of aging organs, but also due to the higher likelihood of taking multiple medications. Drug interactions and slower metabolism can amplify even mild side effects into more serious complications. Some calcium channel blockers, especially non-dihydropyridine types like verapamil and diltiazem, have a powerful effect on slowing down the heart rate. While that may be beneficial in certain cases, it becomes problematic for seniors whose heart function is already reduced due to age or existing cardiovascular conditions. This slowdown can result in bradycardia, an abnormally slow heart rate that often goes unnoticed until symptoms appear. Have you ever felt sudden dizziness, unexplained fatigue, or lightheadedness? These could be subtle signs of bradycardia. In older adults, this condition can lead to fainting spells, serious falls, and a steep decline in quality of life. In more severe cases, when the heart's electrical signals are excessively disrupted, the result could be a complete heart block. This means the heart is no longer able to maintain a regular rhythm on its own, often requiring a pacemaker to restore stability. Imagine the emotional and physical toll of discovering this, all because of a medication that was meant to help. Fluid retention is another concern. Some CCBs, especially dihydropyridine types like nifedipine and amlodipine, can lead to peripheral edema, noticeable swelling in the legs, feet, or ankles. This happens because these medications can interfere with how the body regulates fluids. For seniors, such swelling doesn't just affect comfort, it can limit mobility, increase vulnerability to skin infections, and even make it harder to breathe if fluid builds up too much. Then there's the risk of drug interactions. Seniors often juggle multiple prescriptions for various chronic conditions. When calcium channel blockers enter the mix, they can interfere with the metabolism of other medications. Take verapamil and diltiazem, for example. They can slow down how the body breaks down statins, the common cholesterol-lowering drugs. This interaction can lead to a dangerous buildup, increasing the chance of muscle pain, or worse, a condition known as rhabdomyolysis, where muscles begin to break down. CCBs can also amplify the effects of beta blockers, another heart medication, raising the risk of dangerously low heart rate and blood pressure. Lastly, calcium channel blockers can mask symptoms that people often attribute to aging. Fatigue, dizziness, or minor swelling might be brushed off as just getting older, when in fact they could be early warning signs of a medication-related issue. This delay in recognizing symptoms can lead to missed opportunities for early intervention. One of the biggest challenges with calcium channel blockers is that their side effects, like ongoing fatigue, dizziness, or swelling, are often misinterpreted as normal signs of aging. This misattribution can be dangerous. Imagine feeling more tired or lightheaded than usual and assuming it's just part of getting older, when in reality, your medication might be the root cause. This misunderstanding often leads to delays in identifying the actual problem, allowing complications to quietly progress over time. As a result, many seniors continue taking these medications without realizing that their symptoms may be drug-induced rather than a natural part of aging. If you're a senior currently prescribed a calcium channel blocker, staying alert and proactive is absolutely essential. Clear and consistent communication with your healthcare provider can make all the difference in catching issues early and avoiding serious consequences. So, what should you do? First, prioritize regular monitoring. Make sure your doctor is checking your heart rate, blood pressure, and overall cardiovascular health during each visit. Routine blood tests are also crucial. They can detect imbalances in kidney function or electrolyte levels, like potassium and magnesium, which can signal early warning signs of trouble. Second, never ignore symptoms. If you experience any unusual side effects, such as lightheadedness, fainting spells, swelling in the legs, shortness of breath, or a noticeably slow pulse, report them to your doctor immediately. These are not symptoms to brush off. They could be your body's way of alerting you to a serious medication-related issue. Third, explore safer alternatives. Some newer calcium channel blockers, like amlodipine, may offer a better safety profile for older adults than older versions like verapamil or diltiazem. In some cases, entirely different medication classes, such as ACE inhibitors or ARBs, might be more appropriate depending on your individual health needs and history. And finally, never stop taking a calcium channel blocker abruptly. Suddenly discontinuing these medications can lead to rebound effects, like a rapid spike in blood pressure or sudden chest pain, both of which can be dangerous. Always consult your healthcare provider before making any changes to your medication regimen. Any changes to your medication regimen should always be made under the guidance of your healthcare provider. Never adjust your dosage or stop taking a prescribed medication without proper medical supervision. It may seem harmless, but even small shifts can have significant effects on your cardiovascular system, especially as we age. That's why regular oversight is absolutely critical. The effectiveness of calcium channel blockers in managing serious cardiovascular conditions cannot be denied. They can improve quality of life and, in many cases, are necessary to prevent severe heart issues. But with that power comes responsibility. These medications require close monitoring to ensure they're delivering benefits without unintended harm. For seniors, this means working in close partnership with your healthcare team. Consistent follow-ups, routine assessments, and open communication help ensure that these drugs remain both safe and effective over time. Without this oversight, silent complications can build up unnoticed until they become serious. Thank you for watching this important video on how to better protect your heart health as you age. So let me ask you, what insight from today's video truly resonated with you? Was it a specific medication you hadn't realized could pose risks? Or maybe it's the reminder that even over-the-counter drugs need to be used with caution? Drop a comment below and share one key takeaway that you're going to apply in your own life. You never know. Your story might encourage someone else to take their heart health more seriously too. If you found this video helpful, please comment below, give it a like, and share it with someone you care about. And don't forget to subscribe to our YouTube channel, Healthy Aging Blueprint, for more practical, life-saving tips designed specifically for seniors. Stay informed, stay heart-strong, and as always, I wish you good health, happiness, and peace. And remember, hit that subscribe button so you never miss out on future videos from Healthy Aging Blueprint.